webinar right now. I have a little bit of an introduction to make that gives some logistics and talks about our speakers. So I want to welcome everybody to the National Lead Poisoning Prevention Week webinar series. This series is a call to bring together families and individuals, community and faith-based organizations, industry and grantees, including state, tribal, county, and local governments, and many others. The goal is to increase lead poisoning prevention awareness in an effort to reduce childhood exposure to lead. HUD's Office of Lead Hazard Control in Healthy Homes, EPA's Office of Chemical Safety and Pollution and Prevention, and CDC's Lead Poisoning Prevention and Environmental Health Tracking branch collaborate annually on this observance. The webinars are also supported by USDA's National Institute of Food and Agriculture and the National Healthy Homes Partnership. You can visit the National Lead Poisoning Prevention website at www.hud.gov/program_offices/healthy_homes/NLPPW to get more information and to download the new Partner Information Toolkit. Today's webinar is Primary Prevention Protects, working with residents to get their homes checked for lead. The presenters are Paul Diegelman and Marty Nee, staff members in the HUD's Office of Lead Hazard Control in Healthy Homes, Division of Program and Regulatory Support, PSRD. We are pleased that you have joined us for this event. This webinar will last approximately 30 minutes with approximately 15 minutes at the end for questions. At the end of the webinar, you will be given information on links to additional resources for your program. We will be recording this webinar and posting it for your viewing later if you prefer. Finally, we ask that you mute your microphone during the presentation. If you have questions before then, please feel free to post them in the questions window. And again, I apologize. There is a person mowing outside my door, so I'm about to introduce the speakers, and then I'm going to mute myself so that you don't hear that background noise. So I look forward to Paul and Marty in your presentation today.
Thank you, Michael. Again, my name is Paul Diegelman. I am with the HUD Office of Lead Hazard Control and Healthy Homes Programs Division. I cover Region 5, Oklahoma, and Texas. So today we are talking about primary prevention protects, working with residents to get their lead homes checked for lead. One of the most critical elements for primary prevention of childhood lead poisoning is testing units for lead paint and lead hazards prior to the child being exposed. Whether your program is serving tenants with young children, expectant mothers, do-it-yourself renovators, grandparents helping with daycare, or young couples trying to buy their first home, it is important to know where the lead paint components are, and particularly lead dust hazards, which are where they're present in the home. Knowledge is power, and in this case, the power to protect the child. This presentation will cover the importance of testing for lead, audience targeting, and some strategies for testing, promoting, and connecting your programs to resources for testing. We encourage you to participate at the end of the webinar by asking questions or providing other feedback on strategies your programs may have used in the past successfully to promote primary prevention. With that, Marty.
Okay. You know, I'm getting a little bit of reverberation on the audio here. I'm not sure if anybody else is hearing that, but in any event, stop me if you are hearing me poorly. It should go without saying that a child whose EBLL is prevented because an early test alerted an owner or a resident or a program that there were dangers in the property is the goal of all of our efforts. CDC estimates that 500,000 children in the United States have blood lead levels at or above the CDC blood lead reference value. These children are at risk for the intellectual and behavioral deficits and other adverse health effects caused by exposure to lead. The primary source of lead exposure to children is the home environment. HUD estimates some 23 million.
So Marty has actually disconnected. I apologize. Paul, are you able to pick up where he left off by any chance?
I am. Yes. Again, we do apologize about technical difficulties. He will get back with us. He's actually on the road today at a conference, I believe, in Rhode Island. So he will get back with us momentarily. As he mentioned, the primary source of lead exposure to children in the home environment. HUD estimates some 23 million homes in the United States have lead-based paint hazards that can result in childhood lead poisoning. Low-income and minority children bear a disproportionate burden of lead exposure risk caused by lead hazards in the home environment. According to the Council on Environmental Health and Journal of Pediatrics, focusing efforts on children who have blood lead concentrations under 5 micrograms per deciliter is efficient, but will fail to preserve the majority of lost IQ points in U.S. children.
Or above, we will fail to preserve more than 20 million concentrations.
Marty, hold on a second. So surprisingly enough, I apologize to everybody for this. You actually dropped out for a little bit, and Paul kind of picked up on where you left off. So Paul,
Okay,
Paul
am I back in?
You are back in. You dropped out for about 10 minutes. So Paul, do you want to? I don't care which one of you wants to pick up, but you can pick up wherever you want to. We're still on the slide that says, "Why is promoting testing important to your program?"
And Marty, I just started covering the Council on Environmental Health, so you can take it.
Okay, if you can hear me now.
Yes, you're a lot better.
The Council. Okay, the Council on Environmental Health talks about the populations to focus on, and although it's important to focus on the 5 and aboves, it's also important to focus on the 5s and belows, and that's where the testing issue really comes to a fore, because above or below 5, you still have children who are being impacted and losing IQ points, and I mean the Council on Environmental Health did this study, and it talked about even below 5 micrograms per deciliter, the 23 million IQ points are lost among U.S. children. So no therapeutic interventions currently exist for low blood concentrations. Therefore, and this is really where the money quote is, prevention of exposure is paramount. Paul? Oh, this is me again. So there is a rather obvious benefit from testing. Aside from conducting a full lead inspection and risk assessment on a property and the lead hazard abatement following that, an informed resident is the best defense against lead hazards. Knowing where the paint is, where the potential hazards are, can make a difference. Understanding that the pathway to poisoning is not ordinarily a child eating paint chips, but dust on floors, windows, and soil and toys, and hand-to-mouth behaviors is also key. In many cases, and I'm speaking now to people with programs out there, it will be your programs that take a fairly dry lead inspection and risk assessment and translate it into understandable messages. This is a critical function for your program and for the people who we serve. And obviously, when we're doing this translation of the lead inspection risk assessment, we may want to focus on things that the lead inspection risk assessment doesn't really go into detail on, such as non-paint items. Lead may be found in household dust from lead paint chips and plumbing systems, but it's also imported in antique toys, imported candy and cosmetics. There's occupational exposures, there's pottery and ceramic glazes and soils. These are things that we can flesh out with appropriate explanation of testing results. So it's one of those areas where it's important to keep this in mind for your programs. Paul?
Unit production. For those of you who are attending this webinar who are administering one of our lead hazard control grants, there's also the benefit of increasing unit production through primary prevention testing activities. Bringing eligible families and units into your program can be challenging. However, we hear this all the time from grantees. By connecting with multiple efforts to increase testing, regardless of the type of testing, you can develop sources of production that will help your goal achievement.
Okay. Moving on to the next one is really, let's talk about identifying who best can promote the message for your program. And there are multiple organizations and players within those organizations that can effectively communicate the message regarding the importance of testing and primary prevention. These are people who can speak to residents and to potential new home buyers, folks who are going through uh, WIC programs or other places where there's, young children involved, and can communicate a message effectively. But how do you choose a messenger? Well, I like to think that, it's an old maxim, but it goes, meet the people where they are. And in our context, it means understanding their values, their culture, their language needs, and their fears, and connecting them in a way that is effective for them. Helping residents understand the importance of getting their home tested for lead begins when they can trust you. And, one other indispensable quality here is that the person or organization who's working with the residents to promote this message has to be able to demonstrate how the primary prevention testing need, can be transformed into an action. So let's think about who first. And I think this really, the who depends upon who your organization is. Say, for example, you're a county or city, state public health organization. You may have an inspection, outreach, or case management staff specifically dedicated to families or geographic areas. These staffers often have strong relationships with community groups, private lead inspectors or risk assessors, and public agencies that can collectively offer options for home inspections. These individuals may be the perfect medium for delivering the primary prevention message on testing. I work, just an aside, I work with a lead inspector who's works for the state of Connecticut, who's just a fantastic person. And from her perch as a enforcement officer, she's able to not only interact with the inspectors and risk assessors who need to meet the state standards down in Connecticut, but she's also able to bring together um, the multifamily community, the people who operate and run properties or control Section 8 programs that work with private owners, and bringing these people together and giving them a message on primary prevention has really impacted the testing efforts down in Connecticut. So there's just one example of a person who's like the right person in the right place. But then, there's other organizations that function probably not normally in public health. For example, you might have a municipal or county community development office that uses CDBG or home dollars or other public resources for housing. And these organizations may have less connections to community at the grassroots level. So if your organization is one of these, you may be wanting to partner with community-based organizations in order to get this message out. Say, for example, you fortunate enough to have a lead hazard control grant operated under your program. Then, inside the grant, it would be expected that you would have one or more local outreach partners who would assume the role of interacting with residents and promoting the testing for your program. These are community-based organizations like CAP agencies, community development corporations, health-focused nonprofits, community health centers, hospitals. These are all potential partners in this work. And there's also, and possibly a lesser known place to go for outreach, but utilize your first-time buyer programs. Many times a community-based organization will run these, but sometimes it'll be a housing finance organization or some other partner. And the participants in the first-time buyer programs are almost always young couples with children or planning to start families. And in many cases, the properties affordable for those families will be the fixer-uppers that were built 100 years ago and likely have some lead issues going on with them. The last area, the last sort of subgroup that you may want to think about is if your geographic area houses a specific ethnic or linguistic minority, you may be best served by utilizing community-based health workers who come out of the local community. For example, many organizations serving Latino communities utilize health promotores, sometimes called promotores de salud, to communicate individually with families or collectively with neighborhood groups, and are best suited for this type of promotion. There's multiple examples nationally of these promontories translating, as I said at the beginning, the need, in this case, primary prevention testing, into an action. Paul?
To deliver the message, there are many forms you can use, such as home visits, healthcare, social services through WIC, as Marty mentioned, first-time home buyers, and social media. That we kind of consider breaking the message down into either an individual outreach, which you can do through churches, you can do through, as Marty mentioned, community-based organizations and local conferences within your area. But you can also do community outreach through community partnerships. We have been pushing the health and housing partnership, trying to braid as many resources as possible with the health and housing communities working together. So we try to bring anybody who has an iron in the Healthy Homes lead fire together to meet on a monthly or quarterly basis to talk about sharing the resources to get more bang for your buck. And also, it's a great opportunity to get the word out on the education and the outreach side on primary prevention, on just total lead awareness, healthy homes awareness, funding, any opportunities to get the word out through the message. Marty?
Okay. When we talk about moving on to the next slide, when we talk about the testing, I think most of us in the business just think about lead inspections and risk assessments. And obviously we encourage, where possible, that all of our testing be done by a professional and do a full lead inspection risk assessment or combination of the two. But in some cases, there's a lack of resources, either at the program level or at the resident level, or both, and that may preclude going to a full risk assessment for lead hazards. In cases where funding, may be an issue, or where the resident opts not to pursue an inspection or risk assessment, you may be able to promote less costly test methods. For example, a first-time buyer or a homeowner considering a do-it-yourself renovation might forego a risk assessment but be willing to test play areas, children's bedrooms, etc. with the spot check kit, an EPA-approved spot check kit. These are the ones that are used in connection with RRP activities if it's not federally funded. A spot check kit is valuable because if the test results are positive, the resident or the potential buyer may ultimately choose to do a lead inspection and risk assessment, follow that initial test on with something more comprehensive so that they're better aware of the hazards. There's also, and this was interesting one I've just recently became aware of, is that in Vermont, the public health agencies, they have a action level that begins at 10 micrograms per deciliter, but they don't want to leave people who test between 5 and 9 with no resources or nothing, follow-up to do with them. So, if they get a report of a child with that type of a blood lead level, they get them a mailing, a packet that includes educational materials and follow-up testing recommendations, and they also provide a request to give them a form for a free dust wipe kit that enables the families to test their homes for lead. The families are provided with an easy-to-use floor and windowsill adhesive outline, disposable gloves, wipes for sampling, and containers for the samples. After the samples were taken, a prepaid, pre-addressed envelope is sent back to the public health department for lab sampling. Homes with high lead dust levels then were triaged for further follow-up. This is one of those interim steps where a program that may not have the ability to send inspectors out to each of the homes that has a child with a 5 or above might be able to do an interim step that allows them to just identify those highest risk units, and then be able to follow up with those. Again, this is, it's granted this is not primary prevention, and nor would it meet the criteria for an actual dust sampling test, but it helps the public health agency prioritize resources. And frankly, it might just help stop a 5 or 6 report from becoming a 10 or a 15. Paul?
Target priority zip codes hotspots. There's been a major push in data sharing and data creation through both the programs going on now at the CDC and the EPA's Office of Research and Development. So a good place to get local information is from the CDC's at the state or local level. The primary source of blood lead surveillance data is usually the state-based childhood lead poisoning prevention or the state-based adult blood level epidemiology and surveillance program. These programs are responsible for collecting, managing, and reporting data to ensure that children and adults with elevated blood lead levels receive appropriate follow-up and management. So by receiving this information, you could get an understanding of where your hotspots are based upon zip codes or even down to the census tract. What the EPA has done is that they have just created an Office of Research and Development, and especially in Region 5, they are doing some great work in Lorain, Ohio, and other places. And basically, the new structure will better integrate scientific approaches to environmental challenges, better support mission and customer-focused solutions, and create communities of practice within the organization. So those are two great resources that could assist you in prioritizing the hotspots within your community or where the lead poisoning can be found. The EPA is a pretty brand new source, so if you have not contacted them, definitely go on their website, look for the Office of Research and Development, which gives you some great ideas about the direction they're going along with the CDC. Marty, please.
Yeah. Okay. Hello?
Yes, go.
Yeah, we can hear you.
Okay. Yeah. Well, we're down to the next slide for resources for lead hazard testing. And, we talk about, well, a lot of times you'll be serving communities that don't, either the homeowner himself or herself or the tenant cannot get access to a risk assessor lead paint inspection. And where do you go? Well, there's a number of places you can go, and HUD's lead hazard control grant programs spring to mind as the first option. I mean, we currently have more programs in the field right now than we've ever had before. We're in a fantastic environment for funding lead hazard control programs through the HUD grant funding. And I know I'm going to ask Paul to actually speak a little bit on this, because he was instrumental in promoting this all over the country through a series of webinars and talking to people and hearing about the need for testing out there. So, Paul?
Sure thing. That would be the next slide. So connecting your communities to resources for lead hazard testing. As Marty mentioned, last year we had $323 million, which is in our lead hazard control program. We funded 83 grants. Looks like next year we will be close to about the same if the budget passes. We currently went through the House. We're waiting on a Senate appropriation, but within the House they passed $290 million plus. So it would be a great opportunity if for those of you who have never had a grant in the past, or those of you who've had a grant before who have not had one for a while, to come back into the program. We have changed the no-funder to make it more user-friendly. We have done, we really have we made it a 42-month grant instead of a 36-month grant to assist the first timers in getting started. There'll be more information coming soon regarding the next NOFA, but we will be out working with our entitlement communities in our states and even our small cities to drum up as much support as possible for FY20. Again, we might have around the same amount of dollars that last year, and last year we funded 83, which was by far a record, almost 2.5 times what we normally receive. So those of you who are new to this, have been thinking about possibly coming into the fray, this is the best time to do so. There's also other opportunities such as the CDC surveillance grants through the states, and also a newer one that's been popping up, and really Region 5 has done an incredible job through the Centers for Medicaid Services, the S-CHIP grants. Michigan has done an incredible job. They received $33 million the last few years to do lead abatement through Medicaid on a one-year program. Ohio has received $11 million this year. And basically both Michigan and Ohio has mirrored our grant in terms of ways they fund communities and also the ways that they do the work, scope of work. Wisconsin just passed their the SPA, which is the Special Projects Amendment, and also Indiana has a small program going as well. So this is another opportunity to bring more funding into your community through state, but also, and then the public health agencies opportunity through the CDC, and also working with voluntary programs to train residents to collect blood samples as they've done in Vermont. So this right now, this is by far the best time if you're a community that has a housing rehab program to get into or get an opportunity to find funding through the federal government. There's more money now than there ever has been. But we will be working with our partners moving forward to promote our program. Again, we may be having a quick turnaround to get the NOFA out as soon as possible once there's actually funding behind it. So we will be working with our community planning and development folks and our field policy management folks within HUD. And we will be working with our state programs as well to get the word out to as many communities as possible on the fact that there is so much money out there this year. And it's a great opportunity. And again, one of the things, yes, we do fund the New Yorks and the LAs and the Houstons of the world, but we also fund the Clinton, Iowas, and the Lima of Ohio's of the world. Clinton, Iowa, population 23,000. So if you are with a small community out there and you have a housing rehab program with, again, this isn't rocket science, but there is some sophistication involved in the program. You should have had at least some HUD experience through community block grant or home. And also, as Marty mentioned in a slide or two back about contractor capacity, there should be a few contractors within the local area. We are trying to work nationally to bring in more contractors because, again, there's ample opportunities for work because, again, we've had more funding than we've had in the past. So it's a great opportunity. If you have not had the grant in the past, or if you had one a few years ago and were considering coming back, definitely leave us or email us your information and we will follow up with you because, again, we will be doing some serious promoting soon on the next NOFA. So,
Paul,
Marty.
Can you hear me?
Yes.
Paul? Okay.
Yes.
Can I give it another shot at the regulatory changes? One of the places if we can go back to that slide, there are a few places where, and frankly, we do as much as we can to promote this, but there are a few places who have taken it on themselves to go beyond where the federal regulations are and require rental properties and owners of rental properties to actually do assess their units for lead hazards. Rhode Island has this, and I know there's several under other jurisdictions that do this. Um, it's there's also, again, within the federal regulation, uh, we conduct routine and periodic inspections of deteriorated paint. HUD in its mobile voucher Section 8 program does this. There is some um, talk about increasing the standard on this, and it would be certainly a welcome development to us if they, rather than do just an assessment for deteriorated paint in every unit that a child is going into, if we could actually have a risk assessed. So um, if um, if that happens down the road, we will certainly see a major sea change in how many units are getting tested around the country. There's also, again, in concert with HUD and its inspection criteria in Section 8 programs, whether project-based or mobile voucher programs, we enforce chipping and peeling paint violations. And believe it or not, we've really stepped up enforcement of that and making sure that people actually do the stabilization of the paint, the repaint, and provide us with dust light clearance tests at the end of the projects. There's places where they include lead-based paint and dust hazards as prosecutable offenses in housing codes. There's some cities like Boston and Philadelphia that actually have lead courts. And many states at the state level, Massachusetts, Connecticut, Rhode Island, Ohio, I just to list a few, require a response and a lead safe certificate once a unit is occupied by a child less than 6 years of age. So, that's another way of promoting inspections. And we do have opportunities to further train code enforcers to conduct visual inspections for potential lead hazards and deteriorated paint in pre-78 houses. And occasionally there'll be code enforcement agencies that do sample household dust. And I think Paul mentioned before that there's a when you can identify target areas where there's high needs, that you can do a intensive enforcement effort inside of a one or more census blocks or census tracts. This is really the whole idea behind the major funding that was awarded in the last NOFA for those really high-risk neighborhoods where they're focusing down on, block by block testing and remediation. So anyway, in any event, those are some of the strategies that we've seen around the country that relate to either state or local code enforcement. Paul.
Okay. So that was the quick and dirty. Again, now it's for questions. Michael, I don't know if anybody has any.
Yes, thank you. By the way, thank you both for Marty and Paul for this wonderful presentation. I know it had a lot of critical information that a lot of people needed that are attending this webinar. So there is a question that's already come in, and I want to preface it by saying that we had a webinar this morning with EPA, and the exact same question came up, but a completely different person related to what you've been discussing, which is there any indication by EPA or HUD or other federal entities when the lead hazard clearance standards will be modified to align with the recent changes in the lead dust hazard standards?
I'm actually not sure we can answer that for EPA because it would be an EPA decision on when adoption of a new lead standard would come out. I can tell you that in our HUD lead hazard control grant programs, we've already gone to the new lower clearance standards.
Okay, good to know. I don't have any questions at the moment, but I want to remind people that to do a question, please use the questions window, type in your question, and I will then read it to everybody so we don't get a lot of background noise from everybody's mics. Let's give them a few minutes, and while we're doing that, I might have a couple of questions also for you. Could we go back to the slide real quick? We were talking about the various ways that we can engage the public. I do have a question on that. Perfect. Actually, it might have been the next slide also, but let's keep it here. So of these systems, the social media, the engaging first-time home buyers, are there some that you feel like are, I mean, obviously it's important to get the message out to everybody, but are there methods here that you found to be more effective than others as far as getting more people actually getting the testing done? I mean, I know we're blanketing everybody with this information with social media and home visits, but is there one that really has been the most successful?
Well, I think if I was to have to say, I think the first time buyer courses haven't been utilized as much as they could be, and that would be a fertile ground for promotion of testing. And so I would a little bit different take on the answer. I would say that I would love to see these um, agencies and people who are partnering with HUD focus more on those first-time buyer programs. I think that the home visits uh, by people, particularly people who are serving ethnic communities, as I mentioned, the promotores, I think that's a particularly effective way of earning trust within communities and sort of promoting the primary prevention message. So I would say sort of that whole home visit. If you can get your foot in the door, whether you're a healthy homes program of some stripe or a serving an ethnic community, that's a great place to go to to get your program successfully enrolling people in inspections. Paul?
Yeah, I know of a program in Toledo, Ohio, that if there's a child born in a certain zip code, then the hospital will go to the unit. It's a nurse will go to the unit when the child is actually going home and kind of give us a quick and dirty education on, you know, a lot has to do with the child, but also ways to child-proof the house, as well as lead information regarding testing the child, but also things to do about the house on both lead and healthy homes. So it's a great opportunity for targeted census tract and zip codes to get this information, not so much from the government, but from the hospital itself, who they trust. And so that from them they could, and there's information regarding the grant program and information about their CLIP program. So other information if the homeowner decides that he or she needs more information. So that's one really, really good example of the home visits.
Thank you. That's a really good answer. We have another question that has come in, actually two questions have come in. The first one is that if either of you are familiar with any states or grantees that are using every door direct mail from UPS or other methods of doing a mailer to get the word out on this.
There's a California program doing that, and I'm trying. And if I could, I can't think of it right now. But yeah, there are some programs, but I'm not familiar with the results they've had with the direct mail side. Um,
Okay.
I don't know, Paul, if you have anything.
No, no, I'm not aware.
Okay. Well, that's That's the last of the questions that we've had. I want to take this opportunity to thank both Paul and Marty for a wonderful presentation. I think we're inspired to expand our efforts into other areas and to really, again, the encouragement to engage a wider audience and larger number of people ultimately is a successful effort. Again, we're recording this webinar. It will be posted within a day. Everybody that's registered and has attended the webinar will get a link. I'd like, again, one more time to thank Marty and Paul for this presentation. And with that, we will be ending the webinar.